Assalamu alaikum, guys. Today we are going to discuss about OET writing, nursing part. So in this part, we'll be discussing in detail about the one of the type of writing task that is actually a discharge letter. In OET nursing, this is one of the most common type of letter, and the problem candidates do face, the challenge we can have in writing part. And first of all, the discussing about or the main idea how to write a letter. Secondly, to understand the writing task, even if you are preparing your preparation of OET from today, or if you have been preparing from the last couple of weeks, this video is going to help you out in basic understanding of writing task. So first of all, let's say this is the case notes, as you can see in front of you on the screen. You will receive the case notes like that in the real exam. This will be the first page, right? And maybe this will be the second page. So in the real exam, you can see there, whenever you have the case notes, you should go to this part. Read this part carefully. You have to ask two simple questions from yourself. The first one is, to whom are we writing this letter? Normally, in a nursing letter of discharge, a ward nurse will be writing a letter to the community nurse or a district nurse. As in this case, ward nurse is writing this letter to a nursing in charge of this district nursing service. So in simple word, this is, we are writing a letter to the nursing in charge. So you have to put yourself into the shoes of this nursing in charge. And second thing that you must have to do is to understand that why are we writing this letter. By reading this writing task at time, it's quite clear in writing task that why we are writing. Here, this is only mentioned that to complete the anticipated needs of the patient. We are writing this letter for. Apart from that, they have not mentioned anything over here. So afterward, you can see we have the discharge plan. So at a glance actually, if you can see the discharge plan, so we have following instruction. So it says the first one here will be your, let's say, dietary. Second one is your physiotherapy. Third is other needs. And then we have the anticipated needs. Then we can see in detail about the issues. Let's say the first in detail, it's about specifically about the diet. Then lies on with the dietitian, right? Then the instruction for the diet, have a small meals or snacks. And say last is the plenty of fluids. So post-discharge, this is a dietary guideline that should be followed post-discharge. So we need to understand, okay, what are these guidelines? Obviously, there must be some sort of or type of guideline for the diet that has been done in the ward. So we'll see what that was, and we try to integrate that particular things. Let's say the patient was tolerating maybe light diet in the ward, and now it has to continue again the low calorie and light diet like that. Just we are assuming at the moment, we have not seen the case notes. We'll see the case note and then we will make our mind. But to understand what are the dietary guidelines, we will have an idea that this is the job responsibility of the nursing in charge. Post discharge, she has to ensure to contact dietitian so that dietitian can plan her diet according to the given instruction of low calorie, high protein, local store or gluten free diet. Then we have a second instruction that is related to your physiotherapy. In physiotherapy, the first thing that they had mentioned over here, it's your basically, exercise for 15 minutes as per the physiotherapist plan. And second is the precautions that she must not do any heavy lifting for at least 12 weeks. This is the second instruction. So again, we have to understand that this is your plan for the mobility or exercise related thing under the supervision of physiotherapist. Last, we can see that other guideline that has been described differently. It's the monitor the bruising side to avoid infection. Again, we can see that there must be something in the discharge, sorry, in the hospital, might be some bruising, and for bruising, they are giving instruction to monitor. So nursing in charge should have to monitor the side of bruising. It's a kind of instruction that has been given to the nursing in charge. Followed by the medicine regime. At this point of time, we can see that they have not mentioned anything, like say, related to medicine. They have not mentioned anything related to medicine over here, or maybe here, or even maybe here as well. There is a possibility that patient would be taking some medicine beforehand. So we have to ensure that this medicine should be taken by the patient as the role of nursing in charge. Nursing in charge has to ensure again whatever the medicine patient was taking before the hospital admission, he has to continue this medicine. Anyhow, so at the moment, in the first 5 minutes, we are trying to make up our mind to understand like what it is. So in simple word, whatever the procedure was, we will see what the procedure was, why she was admitted in the hospital. But this is the discharge plan that has to be followed. So let's see. And last point is the arrange regular visit to monitor progress, family visits. So it means that family support is important. As we are writing this letter to the nursing in charge, so is there any possible socioeconomic details can be written together with this particular history wherever we can write it down, right? Okay. Then what we have in the anticipated needs. In the anticipated needs, it's something related to a district nurse to monitor. First is the post-operative medication, as there was no such post-operative medication, exercise and dietary regime. So whatever medicine, if she was taking and it has to be continued after the discharge, it has to be ensured by the nursing in charge that she should take that medicine. Followed by the monitoring by doctor dietitian. Again, we can write this line either with the dietary plan or physiotherapist with the physiotherapy plan. And question mark indicate that this is possible. Possibility of social isolation due to the infrequent family support. Again, socioeconomic details will be important. So now we can see after reading this discharge plan and the writing task, we would have an idea that it is something related to a discharge plan, and this discharge plan has to be ensured by this nursing in charge. Anyhow, on the first page, okay, last see you can see in the nursing management and progress during hospital stay. It's a very concise information. They have mentioned that everything was normal. She was taking, you can see light diet and fluids, and same is the case, it has to be continued. So we can write it down together, we can combine together. Then bruising instruction, if you recall, we had discussed somewhere down the grade about the bruising. And lastly, it's the patient was anxious for home return. So we can write it down where we will be writing the socioeconomic details. Followed by, you can see the first, we can say page. So on the first page now, we'll try to move on toward the next step is to select the relevant case notes. Now, although we had done some selection in the discharge plan, but there was nothing that we can leave. There was nothing that we can leave in the discharge plan. So we will read the case notes in regard to selection. So, so you can see there, we are ward nurse in this letter. We are a ward nurse in this unit, and the name of the patient is always important, right? Then we can see that the address, yes, it can be written or we can omit as well. Normally, if it's a letter, we have to write healthcare practitioner to pay a home visit. Then in that case, letter address is very important. Age, yes, can be written. Yes. And you can see that we already discussed that there was a point regarding the danger of social isolation. In this regard, the social plus family history is quite important in this case of OET nursing. So never married, no children. Yes, infrequent family support was there. In this regard, we can write in a summary form, not in detail, not in priority, but where we will be writing about the social history, where then we have to engage that information as well. So everything almost is important. We cannot, we can say just no longer drives can omit that information. So, but everything was important over here. So as I was discussing with you in the first, on the first and second page, when we were discussing that, we don't know the problem. What was the problem? So we can see here, the patient was admitted and treated, the angioplasty has been done, and she's scheduled to be discharged like tomorrow, as this is 15th is the today's date. And the medical information, we can see whatever information like say colic disease, yes, it's important to write it down. Angioplasty, the past history, you may write or you may omit, it's up to you, right? So like these are the similar information, right? We can write it down. Anxious about health, tend to focus on health problem. Again, maybe some irrelevant information. The medicine that she's being taking, yes, it is important that whatever medicine she'll be taking, specifically because we have to mention about the medicine. And for the hypertension as well, yes, it was instruction. Yes, these medicines should be written. Our weight, yes, we should write it down. Sedentary lifestyle, yes, we have to write it down. Afterward, you can see there we have, let's say, family history of coronary heart disease. In this regard, it's not significant to write it down about the family history in regard to the discharge plan. Hearing loss, yes, we can write it down, but in view of discharge plan, we can omit that, so semi-relevant information. So rest of the details was important. So I was discussing with you, you have to see, first of all, what information is important. We discussed that. Now, the second step will be the organization of case notes. So you have to see in discharge plan is a lot of information in the discharge plan. You have to see, you have to make sure either should start with a dietary plan or physiotherapist or other information. So sequence is a question. So from where we should start? So right now you can comment on the video and you can mention your sequence before you can see the model answer to this question. So whatever the sequence you find it appropriate, you can write in a comment section. We'll try to answer your comments that is the right sequence or not. So what I can tell you, should we start after introduction, after we gives the brief history of this hospital stay, should we start from diet, exercise, or wound care, or social history? What should be the right sequence? So here you should comment on this video so that we can correct your sequence of particular to this letter, as organization of the case notes is always important. So we discuss about the purpose of writing in regard that what is the focus. We discuss about regarding the selection of the case notes, what information are important and what information should be omitted in this case. Now we are discussing about the organization of the case notes, the sequencing or the prioritization of the case notes, right? These are the important things. Okay. So we will try to discuss the further criteria in this letter as well. We discuss about purpose, we discuss about selection, we discuss about organization of the case notes. Now, conciseness and clarity. In this letter, if there was some information related to the hospital stay at time in a discharge letter, they do mention the hospital stay in detail. So in the coming videos, we'll discuss about some type of discharge letters with a lot of information in regard to the hospital admission or the presenting symptoms or the ward management. Then we'll discuss that how can we summarize that information for. We do summarize some information related to the socioeconomic details you'll see in the model answer. But yes, if you want to summarize that particular details, like how would we club this information related to social history that's being there, these 2 points, for example, I would say this point and these information, if you want to summarize, just write it in comment right now. And we will see your comment and we'll give you the correction that this approach, how to summarize the information in regard to socio-economic details is right or not. So conciseness and clarity is important element. And the next is the genre and style. Genre mean transformation of the case notes. So do not use your own language. The language of the case notes. Try to use your own language. Do not use, let's say, if they have mentioned the low calorie, I would want you to give me suggestion that what should be the right replacement for low calorie, right? Okay, high protein, okay, low cholesterol. So try to change these simple words if you can. Keeping in mind that if you're writing to a technical person, accordingly, we have to keep the language. Let's say if you are writing to a healthcare practitioner, the language should be technical, right? Anyhow, the last part is your language part, like tenses, sentences, and so on. So we can see that this is the selection of the case notes. Now on screen, you will see the model response to this question. Remember that this is just for your understanding that how can you write it down this letter. Do not take this letter as a model standard letter or apply this thing universally to each and every type of discharge letter. This letter can be written in different formats. This is one of the format that we have written for you for your basic understanding, even if you are starting the writing tasks from day first. So beside that, we have, you can say 45 minutes time in writing, 5 minutes for reading, and 40 minutes for writing. Now this is the discharge letter we have written. On the top left corner, you can write it down the today's date or the exam date, but these days they are having assumption date. For example, if you have exam on 13th of January 2024, they would give you, okay, let's assume today's date to be 31st December 2023. So we should write it down 31st December 2023 as per the case notes. Afterward, the date can be written over here or over here. It's your choice. Afterward, if we have the designation or sorry, name given, we can write it down over here. Let's say Mr. if the name was there, or Mrs. blah, 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 right? Maybe Mrs. Andrew or whatever. Then we have nursing in charge designation, followed by the district nursing service address, Greenville Community Health Center, without any comma. We are not supposed to write any comma over here. 88 Highton Road and Greenville, right? Then we have to see RE stand for regarding, patient name, his date of birth, followed by the recipient name again, and not name is given, so we can write it down, dear nurse or dear doctor or dear sir, madam. Remember that if you're writing dear nurse, if there is no name, we can put comma over here, and you have to close the letter with the formality of yours faithfully, not sincerely. But if you do have the name, then we can write it down yours sincerely over here if you have the name. Now we can see there it's your introduction, or in simple word, most of the students label it as a purpose of writing. Although purpose is not just the introduction, it's your whole focus of writing. Let's say if your letter is focused, clear, focused, then you have a clear purpose of writing as per the marking criteria. But you must have a clear reason of writing. At least we should know that why are we writing this letter. So I'm writing this letter of discharge. This first line till this point is a convention. It can be written in either way around, like Mr. Martin, who has undergone a successful angioplasty and now required your follow-up treatment. That is also fine. So these are the conventional line as long as you have mentioned clearly the reason of writing. So what we can see in this introduction, it is quite clear that the patient had a successful angioplasty, number one, and secondly, she need the follow-up. So you can see that your reason of writing is quite clear if you are reading the first line. Then afterward, now the time as I ask you to mention the comment, now we'll see if your comment was right or wrong. So we should see the most important detail in regard to the discharge plan would always be anything that can lead toward the infection, such as here we have bruising. So that can lead toward the infection. So we would request the person to start with the bruising point. Let's say Mrs. Martin, post-op surgery has been generally uneventful except for a bruise at the catheter site of infection. Then it's in this format. Either it can be written in either way around. Let's say we can start with the bruise history, and then we ask the patient to mention everything about the bruise. Like, please make sure to see the bruise point, right? So here you can see Mr. Martin recovery was uneventful except for a bruise. This is your hospital management. Followed by that diet thing that has been done in the hospital. Then we can see we have the family sport that can be written over here, that how she would be able to cope it up. And lastly, secondly, is to start the discharge plan. Who needs attention to avoid infection. You are requested to liaise with a dietitian for a guidance and low-calorie, cholesterol-free, gluten-free, however, high. You can see low-calorie, cholesterol-free, gluten-free, however, high in protein diet. Also educate her on frequent but small meals with higher food intake. So everything is quite focused in this letter with regard to the discharge plan. Then we can see we focus on the physiotherapist point. For physiotherapist point is needed, right? And then monitoring medicines of this and this. We have not mentioned the name of the medicine. We can mention the name over here, right? In the brackets. And last point is the socioeconomic. Independent woman without family support faces the risk of social isolation. You just have to concise information. We have not written in detail like how many family members over here. We just have written, and she is an independent woman, means that she is living alone and there is no family supporting her. That is sufficient for her to provide this information. And then social isolation point was covered over here. And this is your sign of statements. Sign of statement mean you are closing the task. So, sorry, this is your sign of statements. I would appreciate if you could ensure her aforementioned needs. Please do not hesitate to contact me if you have any further queries. And lastly, yours faithfully and ward nurse. So, this is just a brief overview of your discharge letter that we had discussed. So before we can close this lecture, I'd like to summarize. We discussed about the selection of the case notes, organization, and how to organize the letter into a proper, appropriate structure of writing task. If you still have any question, you can ask in the comment. And I'm going to tell you in detail, like M&M is going to provide you not only the classes, but okay, so I'm going to provide you in detail that M&M is not going to provide you just only the classes, but also we will help you in preparing of the exam, as we have one of the unique feature that nobody is going to offer you is the number of mocks. Indeed, there are 37 mock tests on daily basis from Monday to Friday with a comprehensive feedback. It's not 10 letters, it's not 5 letters, it's not, we will say that we have a smart package and we don't have anything. You know, people are having the playing with the price tag, but actually they are lowering the price and they are going to give you nothing. So here we have extensive course classes with feedback. We have a footprints of 7 years in OET. We have a team of around 29 plus people, mostly doctors in OET, like 8 to 9 doctors are there in the team. We have people who are in charge of our writing tasks. They are doctors actually, and their whole team, there's no actually, you know, like a known doctor resource, only one or two, but most of the people in the team are doctors who will be assessing your writing task, will be discussing on your writing task, and then they'll give you the feedback. Then we have a team who is responsible to listen to your speaking and write it down, the feedback on that. And they're all doctors. So it's extensive team managed by mostly the doctors who will be giving the feedback. And then not only that, we have also a team of interlocutors who are responsible to conduct speaking session as per the guideline of OET. When you will be taking our mini mocks, or you can say initial mocks and final mocks. So on daily basis, there will be a complete mock, listening, reading, writing for 20 days continue. So you can see 20 mocks. Nobody is going to offer you that offer. Followed by final mocks. There are 17 final mocks. Again, in total, there are 37 number of mocks under the price tag that is quite affordable, quite nominal in price that we are offering. And if you're interested in a crash course, we have that option also available. And join M&M so that you can ace your success. Thank you very much.